All right, hello everyone. We're just going to give it another 60 seconds as people log in. Sorry for the delay. We just, it's Zoom. We're just gonna give it like 20 more seconds as people log into the Zoom. All right, why don't we begin? So, hello everyone, good afternoon, welcome, thank you for joining us. I know we're starting a few minutes late. We just wanted to make sure folks weren't experiencing any issues logging on and accessing our Zoom. So my name is Jenalyn Soto. My pronouns are she, her, and I am the Senior Manager of Strategy and Policy at the National Women's Law Center. Thank you again for joining us on today's webinar. I know there's a lot going on. Briefly, I am going to just have some housekeeping and then before turning it over to my fellow panelists. So we are recording this webinar for transcription purposes. We will be sending a transcript in particular to those who have requested extra accommodations. We'll also be following up with relevant links, such as a link to the public memo that contains a lot of the data that our two brilliant pollsters will be presenting on, as well as relevant links for some of the bold policy actions that our colleague will be presenting on at the latter half of the webinar. Excellent. And feel free to chime in throughout the webinar with your questions for the panelists. We will compile all of the questions and answer them at the end, just for the sake of time, since we did have some tech issues. But if you have an immediate issue or concern, feel free to flag it for us too, and we'll try and address that in live time. Excellent. So really quickly, again, I'm Jenalyn with the National Women's Law Center, and the Law Center was founded in 1972. We're a national legal advocacy and civil rights organization championing gender justice for all in the courts, in policy, and in our communities. The reason I'm opening up this, this webinar is because this poll and this project is part of an initiative that I work on here at the Law Center called the Pathway to Gender Justice Initiative. It is a multi-pronged, multi-year policy organizing and community engagement effort that we launched last year, and it seeks to build an inclusive society by centering women and girls in the ramp up to the election and beyond. Through it, we're going deep with longtime partners in key battleground states like Michigan, which is our case study today, to really uplift and elevate everyday folks' voices and lived realities. I also work on our recently launched Action Fund, which seeks to more robustly center intersectional gender justice and drive people to connect themselves to what's at stake during these very consequential elections and fights. And one of these really consequential fights is around COVID. It is both a public health crisis and a resulting and really devastating recession. Many of our communities haven't seen relief, and recovery has been further stalled by political brinksmanship. And we're super mad about it. Michigan is a perfect example. So with that, I turn it over to my friend and co-conspirator, Ebony Taylor. Ebony?
Hi, everyone. Thank you so much for joining us today. My name is Ebony Taylor, and I am the Executive Director.
Ebony, we're having difficulty hearing you.
Sorry.
Um, okay, how about this? While Ebony figures out her tech situation, um, maybe we can
Okay,
turn it, oh,
can you hear me now?
yes, perfect.
Okay.
I was
Hi,
just stalling for,
so sorry about that. Zoom, you never know what'll happen. So again, my name is Ebony Taylor. I'm the Michigan Executive Director of Mothering Justice. We're a statewide organization that focuses on issues that impact mothers of color. We mostly engage Black women in the state, but certainly our overall goal is to focus on moms of color. And so we're a public policy organization and advocacy organization, and we have 4 target areas, policy areas that we are focused on right now. One being affordable child care, paid family leave. The second, third, third Black maternal health, and then the fourth one is safety net. And so this poll came about because Jenna Lynn, she's probably tired of me bugging the National Women's Law Center, but when our Governor Whitmer, Gretchen Whitmer was being essentially attacked around her stance, the stance that she took in terms of how to respond to COVID-19. Myself and my colleagues at Mother and Justice were really concerned about our members sort of siding with the protesters because a lot of our moms had lost jobs due to the state closing down and the expectations that came with that. And so we wanted to sort of take the temperature of our moms, of really all women of color in the state. And so I contacted the law center. They were just super excited about taking on this statewide poll, and we got some great numbers from it. I won't get too deep into the numbers because that's what Vision, Strategies, and Insights, they're on this webinar to do just that. But some things that really stood out to me were that 8 in 10 women of color in Michigan reported being affected by COVID-19. 2/3 of those reported being affected financially by COVID-19, including a reduction of work hours, getting furloughed, losing their job, and being forced to quit to take care of someone else. And that number for women of color in households with children, we saw that 4 in 10 were essential workers, and most didn't feel safe at work. And finally, an overwhelming majority of Michigan's women of color voters are overall eager for systemic change around the issues that I previously mentioned that are Mothering Justice's focus for this year and beyond. And so just super happy to tee up this conversation, super happy for this poll having taken place. And I'm here also to learn even more about the numbers that we dug up around how people feel about COVID-19, mothers of color, and just women of color in general. I'm interested in learning even more about what we found. Thank you so much, gentlemen, and everyone on the call.
thank you, Ebony. And without further ado, I turn it over to our brilliant and amazing pollsters, who I hope tell you just a little bit about their great firm, Michelle and Brenda.
Hi, everyone. I'm Brenda Lee, and I'm a partner at Vision, Strategy, and Insights. There is absolutely no pressure in that introduction. I'm going to start us off, and then Michelle and I are going to kind of tag team through we've got a number of slides, but we've got limited time. So we're going to give you, sort of the overview, and then hopefully if it generates some questions, then afterwards we can follow up with things that you'd like to know. So as mentioned, we conducted a survey among women of color to explore the effects of COVID on their lives in Michigan. Hang on one second. So
I'm about to share my
screen
screen
on the slide, so we can go ahead and put the presentation up.
Let me know if this is, can you all see that?
Yep, there it is. Second slide, please. So what was already mentioned is that this was done on behalf of Mothering Justice and the National Women's Law Center. This was a survey that was conducted among 600 women during the May 20th to June 4th timeframe. So it's important to just footnote here that that was right after the George Floyd killing and at the beginnings of the national protests that were occurring around the country. So there was, we were certainly distracted as a nation on those issues. So although it was done at the beginning of the summer, so the issues that we uncovered, the results that we uncovered, I mean, who would have thought that we are really dealing with some of the same issues? And so the findings really have relevance even as we move forward going into the fall. Our survey sample comprised about 68% African-American women, and the remainder were women of color that included Hispanic women, Asian American women, Middle Eastern women, and women of North African descent. So as already mentioned, our findings clearly said that quite a number of women of color in Michigan were directly impacted by COVID. Many of these women themselves had a physical impact. They themselves had tested positive and become ill. African-American women were more likely to say that they knew someone who they'd lost a loved one during the COVID pandemic. And Latin American and Asian American women were more likely to indicate that they had been personally affected themselves. But overall, clearly, women of color in Michigan have been impacted. Next slide. So the majority of the women that we spoke with or contacted that showed symptoms of COVID had not been tested or treated. I think it's really significant to note that 24% of those, only 24 or 25% of those that had symptoms had received any sort of treatment. So the vast majority, 75% of women, received no treatment at all. For whatever reason, African-American women seem to fare a little bit better than their Latina sisters and Asian American sisters in being able to receive some sort of treatment. There was a big disparity there. 28% of them were able to receive treatment versus only 19% of the Latinos and Asian American women. Next slide. 60% of respondents reported knowing someone who had been impacted by COVID. So clearly this is in keeping with the narrative throughout the country of women of color or people of color being disproportionately impacted by COVID. We didn't see any significant differences between ethnic cohorts, but just generally we were more impacted. Next slide. Nearly 70% of Michigan's women of color were financially impacted by COVID. And this included things like their work hours being reduced or being furloughed. Those were the two biggest areas. Some, about 10%, indicated that they had lost their job during the pandemic. And then again, from an ethnic segment perspective, we didn't really see any differences in the financial impact, but all have been impacted by those three various aspects of financials. Next slide. The survey population was generally women of color, but we were able to pull out a small segment of those respondents who were also business owners. And so it's a small sample, but of those that we did identify as business owners, not surprisingly, 70% of them were impacted by COVID, whether that meant that they had fewer clients or lesser revenues, but they were impacted. About 10% actually had to close their doors. And then in keeping with less revenue and less clients, many of them reported that they had to cut their employees' hours, which of course we know then creates the trickle down of employees with less hours are making less money, and so they themselves and their own households are being impacted by COVID financially. Next slide. 8 in 10 respondents reported other negative effects of COVID. I mean, oftentimes the surveys that are done focus on the financial impact of COVID and whether there are physical health aspects. We tried to delve a little bit deeper to find out whether there were other ways that families and women of color were impacted. And what we uncovered is that a significant number, 30%, indicated there were mental health implications. Many of them had experienced food insecurity. And then there was, and 4 and 10, which I'm sure contributed to the mental health number, were separated from family members because of them or the family member working on the front line, or the risk of associated with health conditions and being exposed to the COVID virus. So clearly there were other negative effects on this community. Next slide. Again, probably not surprising news, but a significant number of women of color are considered essential workers. So many of these women are working on the front line, and you'll see that the respondents living in these households, many of them had children. And in keeping with that, many of these essential workers were specifically in the healthcare field. So may have been, in fact, working directly with COVID patients. Next slide. A whopping 70% of essential workers had to report to work, regardless of the lack of safety in their work environments. And many of them reported that they actually felt unsafe. They didn't feel that employers had put things in place to keep them safe. They were just, being utilized for their work responsibilities. The 2 primary reasons given for not feeling safe in their workspace was the issue of social distancing and the issue of wearing face masks. And if you recall, and Ebony kind of teed up on this, is that Michigan was having all of the protests around wearing face masks and the need for those kinds of protections. And here our respondents, women of color, are saying that we really need those to feel safe. Next slide. Given the nature of some of these women, the type of work that these women did, only about 1/3 of these women said that they were in a position where they were able to work from home. And so that forced them to have to go out into the workplace. This was certainly more pronounced among younger moms, younger women. When we got to older women, I'm sorry, I said that in reverse. It was more pronounced among older women. Some of those older women may have been retired, so we need to make a footnote of that. But 18 to 34-year-olds were probably more likely to be able to work from home. And so that gave them a little bit of an out. Again, this is the non-essential population. Next slide. I'm going to speak specifically about the impact of COVID on parents of color for just a few minutes. Just a couple of slides here. So most parents of color reported, not surprisingly, having difficulties with homeschooling. The requirements for them to sit with their children and work presented a challenge. So they had difficulty finding the time to sit with their children to help educate them. And then in about 25% of the cases, they didn't have the equipment or supplies to be able to provide the type of schooling environment and situation that was required at home. In addition to that, 1 in 10 reported conflicts between their work schedule and the care of their children. Next slide. I found this an interesting finding that overall, most parents were actually pretty satisfied with the educational resources that were being provided to them by the local school districts. And within that, the group of parents that were satisfied, African-American women were most satisfied, as well as those living outside of the Detroit area. And I think that's really a unique finding. Because in other work that we've done, we've found that hasn't been the case, that parents are overwhelmed by the process, but they're also dissatisfied with the support that they're receiving. So in keeping with that, I'm going to pass over to Michelle for a bit, and I'll be back and talk to you at the very end.
Great. So next slide, please. We're going to talk about the Stay Home, Stay Safe order, which, in Michigan was extended several times, and then has been complained about several times, and they are still under some orders, as are many states. So it has gone back and forth. But this was at the time, it was in full, it was a full order, and it had just been extended. Next slide, please. Great. So a majority of respondents that we surveyed were in agreement with the Stay Home, Stay Safe order. They, and it increased in age. So the older the respondent, was, the more they were likely to believe that staying at home was the right thing to do. So we gave them the choices of the right thing to do, went too far, didn't go far enough, and I wasn't sure. And overwhelmingly, people thought that sheltering in place, or staying at home and staying safe was the right thing to do. Next slide. And then when we asked about their, has it changed, since you originally, because we were dealing with this extension and all the pushback to Governor Whitmer, 9 in 10 respondents said that they continue to support this executive order, that they either supported it more now or felt the same about it. Only about 1 in 10 felt that they supported it less. So again, continued very strong support for prioritizing health over economic concerns. And again, the younger respondents were slightly less likely to support it than their older counterparts, and anyone who has a millennial or Gen Y child at home can understand that. Next slide. Thanks. There was a little bit of difference in support between across ethnicities and voter status. So we pulled out where it was relevant. We pulled out, are you a registered voter or non-registered voter? And again, as Brenda mentioned earlier, African American or Latina, Asian American, and other. So registered voters and African Americans had the strongest support for the continued stay-at-home order. And you can see the variation is very small, but it's just interesting to note in terms of actual registered voters being even more supportive of the orders. Next slide. And so when we asked about, we asked them why you were more supportive. So you're going to see a series of slides, these next couple of slides, with some verbatims. Oh, I'm sorry, go back, thanks. So the people who originally thought the stay-at-home order was the right thing to do, and then they continued to support it more, said, we need to, again, it was like prioritizing health. I didn't understand the severity of it, but once the governor created the order and I started seeing people getting sick, I took it more seriously. This is serious, people are dying. I don't see anything to debate about. These are the most strong supporters. Even the people who feel that, who felt, again, these are people who felt strongly about it. So people who felt strongly about it and feel the same now said, we need to take time, and the faster we move to reopen the economy, the more of a chance it will resurge. These people had a lot of sense then, and in retrospect, we can see that they were absolutely true. The one concern that people had, the very few people who said they supported it less, is because we have no idea how long it's going to go, and it's time to move on. But this was very few people. Next slide. The people who thought that the order didn't go far enough, right, were looking for an even harder line. So it's like, I support it now because I've been seeing the cases going up. I want to save lives. So again, the people who supported it were really, had experienced it, which we've seen in the past, that people who haven't personally experienced it have less support. Especially these women of color have seen the impact and are definitely wanting a harder line to make sure that the health impact is stopped, and then to move forward onto the economic impact. Next slide. And the people who thought that originally thought that the order had gone too far, but then we asked them, how do you feel now? Some of them said, well, yes, I realize that it's more serious than I thought. But some of them, felt that it was arbitrary and onerous, and those tended to be people that weren't as impacted. So I live in Lansing. I don't know anyone who had it. There was, and again, this was a small group of the people, but that what they pushed back on was just how you know, how difficult it was, and they felt that they were like contradictory and kind of arbitrary, and that's what they were pushing back on. The next slide. And then the people who didn't know about it at all, who weren't sure, that was the 10%, and they weren't, they again had come, by the time that we asked them, okay, what do you think about it now, supported it more for the most part, because they had a better understanding. I didn't expect it to go as far as it did. I didn't expect as many deaths. And I, you know, began to think it was necessary. So the overwhelming number of people who, you know, wherever they were on the spectrum when the stay-at-home order first started, tended to support continuing it because the severity had grown. Next slide. Okay. So then we asked if you, if it was due to expire at that time, at the end of May, and we said, you know, what would you like to see the governor do? And most people wanted to either, you know, extend it or relax some pieces of it. So very few people said I want to get rid of it altogether, but they did want to see some of the restrictions relaxed. Some of the respondents, especially in the younger in the younger groups. The younger groups throughout this study were more concerned about the restrictions than were basically anyone over 35. Next slide. And so there was very little support for relaxing the, for eliminating the current restrictions altogether. And households with children were more likely to want to extend all restrictions than households without children. African-American families more likely than their Latina Asian counterparts, I'm sorry, respondents, not families, to extend their restrictions. So there was very little support for let's just throw this whole thing away and pretend there's no coronavirus. Next slide. And then we asked them if we were to restrict, if we were to relax some restrictions, what would they be? And the majority of people wanted to see non-essential businesses opening up again, and some of the stay-at-home orders relaxed. So they, you know, they wanted to have a little more freedom to go about their business, and they wanted to see other business open again for mostly for economic impact. Interestingly, they did not want to see schools reopen until the, you know, at that point, until, you know, things have gotten better. Next slide. And so we asked them, you know, about the, you know, about kind of the conditions around which they would want to see the economy opening again. So we said, here's the statement. We should only reopen when COVID-19 testing has been widely available to all at no cost and the curve has sufficiently flattened for a sustained period of time. And so you get, you know, nearly half of people agreeing with that statement, completely agreeing with that statement, more than half agreeing 4 or 5. Again, the older cohorts much more likely to completely agree than the younger cohorts. Next slide. And then we asked about Governor Whitmer and how they felt about Governor Whitmer's performance, and she got very high marks, again, particularly among the older age cohorts, believing that she has done an excellent job. You know, even among the younger cohorts, you know, 6 and 10, more than, you know, 6 and 10 felt that she had done an excellent, or, you know, like rated her a 4 or 5. So there was very little pushback on the work that Governor Whitmer had been doing to handle coronavirus in Michigan. Next slide. And then, you know, there was this, we asked, you know, what you would be, you know, how comfortable you would be when the stay-at-home orders were lifted, how comfortable you'd be doing these activities. There was some discomfort around returning to work or shopping, but the largest discomfort was returning to beauty, nail salons, bars and restaurants, concerts and events. and half of the parents were not comfortable sending their kids back to school or to childcare or other youth activities at that time. Next slide. I think that's it. Yeah. So I turn it back over to Brenda, and I think we have like 4 more slides.
Somebody has to do it before a Zoom call is over. Start talking before the mute is off. So I'm going to take the last few minutes and expose you to some ideas that were shared with respondents to get reactions from them on, sort of life post-COVID. What are some things that they wanted to see coming out of the pandemic as we went forward? So, I can't see the presentation now. Oh, there it is. So one of the things one area that we wanted to explore were proposed changes to the workplace coming out of COVID, having gone through this experience. And I won't read to you each of these statements or concepts that we exposed participants to, but just to give you a quick snapshot, we wanted to get feedback on providing essential workers with equipment and resources, guaranteed paid leave and reasonable accommodations, ensure unemployment benefits that extended beyond the current the plan that was in place. So once those economic conditions expired, that people would continue to get help. Emergency hazard and premium pay for certain work groups. Workers at high risk for contracting COVID be given the right to refuse to work and still be able to collect unemployment benefits, and then whistleblower protection. So those were the kinds of things that we explored with respondents. And the majority of respondents supported all of these things. They wanted changes to come out of this. The areas that received the most support were personal protection equipment being provided to frontline workers along with other essential supplies, a safe harassment and discrimination-free work environment. Those were the two that sort of bubbled to the top. But as I mentioned, everything received strong support. There's so many areas of improvement. Next slide. For those same concepts, we looked at by age support for these different aspects of improving the work environment. Overall, older respondents were more enthusiastic for the recommended changes, but there was strong support across all of the age groups. We also presented, next slide. We also presented some ideas for health assistance, and briefly, these were covering the cost of testing and treatment for COVID, improved Medicaid coverage for pregnant women and postpartum women, and then access to comprehensive and affordable health coverage that guarantees that everyone's medical needs are met. And so in terms of health assistance, there was strong overall support for all 3 of these ideas. No cost testing and treatment for COVID was supported by 70% of respondents. Not surprising, given that we were still in the midst of a pandemic, but that was very heavy on people's minds. But the other 2 concepts received quite strong support as well. Next slide. And my final slide. There was also a great deal of support for potential COVID financial assistance. Most respondents said that they fully reported strengthening unemployment protections, additional direct cash deposits, increasing funding for childcare programs, increasing SNAP, and lowering barriers for many of these programs. But again, everything that we presented to them in terms of needed financial assistance, there was a great deal of support for. People, clearly, these women said they needed help. So with that, that's the very quick overview of the findings, and I will turn it back to Jenna.
Thank you so much, Brenda and Michelle. So really quickly, before I hand it over to Andrea, I just want to note that, again, especially for those on the phone who are calling into this Zoom, we will be sending the public memo with all of this information in the follow-up. And one reason this polling for us still remains very much one of our North Stars in dictating how we are lobbying and organizing, is that even before we hit that heartbreaking number of 200,000 US deaths because of this virus, there was a myth, a false notion going around that, oh, I don't know anyone connected to or affected by COVID. Therefore, these policies, these supports, this concept of relief does not really apply. It's not really the most pressing and urgent matter of the day. And yet we have clear data that shows that in communities of color, especially especially Black women, Latinas, AAPIs, Middle Eastern and North African folks, this is really the issue for us, the key concern. It has touched our lives in so many different ways. Some of us, we've lost our lives to it. And so having said that, I'd like to turn it over to my fierce colleague, Andrea Johnson.
Thanks, Jenilyn, and thanks for all of this polling that is just so helpful to, like you said, understand the issue. So my name is Andrea Johnson. I go by she, her pronouns, and I'm Director of State Policy at the National Women's Law Center. And as we've seen in this polling today and from research that we've been doing across the country, women of color are really bearing the brunt of the COVID crisis as essential workers, as caregivers, as breadwinners losing income, as people getting sick. And yet, women of color are being left behind and left out of Congress's COVID relief and recovery efforts. And this is not an accident. I think, as we all know, it's a result of the pandemics of white supremacy and misogyny. So in response to this, a broad coalition of national and state groups have come together over the last several months to launch what we're calling the We Demand More campaign, to name the fact that women, especially Black and brown women, are on the front lines of this crisis, and to set out a list of demands for a recovery effort that centers racial and gender justice. And while we really need to keep the onus on Congress and the president to deliver on COVID relief and recovery, we've been tracking what state lawmakers are doing and finding that some states are really pushing ahead with important protections. For example, instead of letting corporations off the hook for putting their workers' health and safety at risk for the sake of profits, OSHA should be enacting a standard to hold employers accountable to providing COVID-specific safety protections for workers. This is what the polling showed. People need and want PPE. This should be a basic priority. But OSHA hasn't acted. So we've seen states like Virginia go ahead and put their own standard in, which is really exciting. A safe workplace also means a workplace free from discrimination and harassment and things like pay discrimination, which I think the polling also goes to that. And this is a really serious issue right now because so many workers are desperate to keep a paycheck and less willing and able to report workplace abuses. So much more at risk of harassment and discrimination. In North Carolina, we saw a few months ago, a lawmaker introduce a bill to strengthen protections against workplace harassment as part of the effort to rebuild from COVID. And also the California legislature recently passed an equal pay bill that requires employers to report pay data broken down by race and sex. It's that important transparency and accountability on wage gaps is crucial. Policymakers' efforts to rebuild safe workplaces must also focus on pregnant workers who are too often denied accommodations, this has long been the case. And now it's including things like being denied PPE, telework, or moving to a less crowded work area, or changing their start time so that they don't need to be commuting during peak hours. Tennessee recently became the 30th state to enact reasonable pregnancy accommodations, which is incredibly exciting. This is a really important step to reducing racial disparities in maternal and infant health outcomes. And I think the polling talked about how folks obviously want more access to healthcare. And so instead of sacrificing public health and basic decency by depriving large shares of the population of paid sick and family leave, as Congress did in the relief packages, policymakers should really be ensuring that all workers can take paid job protected time off to care for their loved ones and for themselves. So after COVID hit, we saw two exciting developments in the states. New York and Colorado both acted to fill gaps in the federal emergency response, and also to make paid sick leave protections available even after the pandemic, because it's not like it's just now that we need paid sick days. We always have needed them and always will. And And COVID relief efforts must address the massive barriers to accessing healthcare that Black, Indigenous, and women of color have long experienced. That means expanding Medicaid to more individuals, extending coverage for pregnant and postpartum women, special enrollment periods, and no cost sharing for COVID tests and treatment. And that in particular is an area where several states have acted. It also means robust healthcare anti-discrimination protections and ensuring access to reproductive healthcare, including abortion care. We saw West Virginia and South Carolina both recently enact laws so more people can get a year's supply of birth control at once during the pandemic, where it's especially important, but beyond as well. And instead of devaluing childcare, which I think we're seeing more clearly than ever how it is a backbone of our economy, and instead of devaluing childcare workers, so many of whom are Black and brown women, policymakers must make equitable investments to ensure high quality and affordable childcare for all. States like Pennsylvania and New Jersey have been taking charge and looking for more ways to support childcare, like directing coronavirus relief fund dollars to childcare. These funds are running out, and really the onus is on Congress to provide at least the $50 billion needed to stabilize childcare. This is a massive issue that any relief response that is effective, but definitely one that centers racial and gender justice must focus on. And I'll end by emphasizing that instead of allowing gender and racial disparities in education to widen, policymakers must rebuild a more equitable education system where Black and brown girls can thrive. This means eliminating discriminatory dress codes, which is a really important, exciting advance we saw Virginia make progress towards this session. Includes things like banning the use of suspensions and exclusionary discipline during virtual learning, and investing in mental health counselors and not cops, as this is an especially stressful time for so many students, but especially Black, Latinx, and Native students whose communities, as we've heard through this polling, are really being hard hit by COVID. And especially as we continue to see racial injustices, just like we saw yesterday with the non-indictment, students need a listening ear to guide them, not someone wielding the power of arrest or physical punishment for having a bad attitude or wearing a mask incorrectly at school. So I know we're running short here on time, and want to leave space for others like Ebony to talk about other things, policies that are so important in this moment. The list goes on. I mean, the need is so incredibly great, and it's things like extending eviction moratoriums and at the same time increasing rental and mortgage assistance, because even if you can't be evicted, if you need to pay rent later, that can be devastating. Extending unemployment insurance, ensuring immigrants aren't carved out of protections, which has been the case in a lot of the congressional relief. We've seen states like California and Connecticut take steps to make sure that immigrants, undocumented or otherwise, are receiving supports, supporting those with disabilities, survivors of domestic violence, and incarcerated populations. This is all part of a COVID relief response that really centers gender and racial equity. And we will be pushing for Congress to take this up, but we are also pushing in the states and excited to see the advances that are happening at the state level.
Thank you, Andrea. Ebony, we have just a little bit more time before I turn it over to Patrice for Q&A, but did you want to chime in with any sample policy wins or sample policies that really can be advanced on the state level?
So in Michigan, we're
Your audio is puttering out again. Can't hear you. We can't hear you.
How about now?
Yes.
Okay, my AirPods keep going back and forth, sorry. So, I mean, I've talked about this a lot, but our win around earned paid sick days in 2018, and I should have did the air quotes, but we had a much more expansive version of our earned paid sick time law that was passed for a hot second in 2018, but was hijacked and lame duck, and it was watered down tremendously. We're still counting it as something, but it's a fight right now that we are still working on getting it reverted back. I mean, and I've been saying a lot during this pandemic that had it been passed with the same efficacy in which we, brought and how we brought it forth, a lot more people would not have suffered as greatly as they have during this time. We are working on some other policy pieces. Thankfully, our governor around implicit bias training, she's required it for all state workers. She's required it for state healthcare workers to go through this process. That's actually one thing that Mothering Justice, as we think about our Black maternal health work, as we think about Black maternal mortality, and even infant mortality, that's something that has to happen. So we're actually thinking about how we can use what the governor has already done to spring as a springboard for more wider ranging policies around that area. And so certainly just in thinking about this pandemic and thinking about our issues and hearing from our women of color in Michigan, I think we know more now the direction that we need to head in terms of statewide policies. And we hope that we can set an example, as Andrea, laid out some great examples from other states. We're hoping we can set an example here in Michigan, and other states might follow suit.
Great, thank you. We have some time, and I know Patrice just invited everyone, all of the attendees, to drop additional questions in the Q&A that have not yet been addressed. But in the meantime, we did get some questions in advance via email, so I'm going to turn it over to Patrice.
Hello, can everyone hear me? Yes, okay, great. I am Patrice Witherspoon, Manager of State Strategy and Policy here at the Law Center, and I'll be moderating this portion of our webinar today. So I'll just go ahead and jump right into some of the questions that we received via email for our panelists, and whoever would like to answer, or we can answer, everyone answer, but remember to unmute yourselves, please, and thank you. So our first question for our panelists is, what specific policies can state advocates support that will ensure a safer environment for our essential workers?
You said what policies can, say it one more time?
What policies can state advocates support that will assure a safer working environment for our essential workers? And so if you have, specific expertise, Ebony, of course, Michigan would be your state, then let us know what we could do to help protect the safety of essential workers.
I think honestly, and I hate to be repetitive, but the sick days piece is really important, that we get it back to being able to cover more people. Millions of people actually, with the gutting of that bill that I mentioned earlier, the law that I mentioned earlier, that was adopted and it was adopted and then amended in the same session. Millions of people lost that ability to take days off. And what that means is that more people are at risk at work. So if I'm not feeling well and I'm having COVID symptoms, but I have kids and I have a family to support, then I'm still going into work, and just maybe I wear my mask, maybe I try my best to not be around, others, but depending on the job, we're seeing people getting sick. My sister-in-law was a clean, janitor at one of the auto plants here, and they were especially during the height of the pandemic, they weren't really providing a lot of the, the PPE. People were getting sick. Unfortunately, someone passed. And so just imagine if those same workers had, earned paid sick days and being able to stay home and have that 14-day, that time to just sit still and make sure that they're okay. They're having to go back into work. So I'm just gonna stay firmly planted on this earned paid sick days piece and any paid family leave policies that, will allow people to stay home and recover versus go to work, expose other people and get sicker.
And I'll just add to that, one other area of reform that we've been thinking a lot about is making sure that those who are not able to, that have to quit because their employer is forcing them to engage in unsafe activity, isn't creating a safe workplace, that they can still get unemployment insurance. It was and still is, quite frankly, a really scary moment for a lot of folks as their employers started to open up and call them back to work. And like I mentioned before, the safety standard, the OSHA safety standard has not been put in place to really require specific COVID safety protections. And that has meant that not all employers are creating safe workplaces. And it's putting workers in this horrible bind, this impossible bind. And so paid sick days, totally plus one that, and then also things, making sure unemployment insurance can also help these types of situations.
Did any of our other panelists want to speak on that before I move to the next question? All right. I know that we were all kind of pleasantly surprised by that piece in the data, especially by the fact that Black mothers are relatively pleased with the resources they're receiving for virtual learning. However, there are still a lot of parents that are struggling due to childcare accommodations. So how can advocates kind of support the policies that will support better childcare accommodations, kind of like the paid leave policies?
I think, so for us at Mothering Justice, we've really been trying to go deep around informal childcare workers, informal childcare spaces. We're talking about, what I mean by that is, neighbors, friends of the family, even family members. How do we support or include in our current child care market or system ways to, ways to include informal child care on the same level in some ways as formal child care. Before COVID, Detroit was a child care desert anyway. And so you can only imagine the status of Detroit and its metropolitan area during this pandemic. And it's shot. And so we're wanting to actually just see a plan, period, to keep the market alive, the childcare market alive. But we're also wanting to advocate for, and we have those informal childcare people ready to advocate for themselves around, more support, more money within our subsidy program here in Michigan that can go toward the informal sector. And so we actually need those people right now more than ever, because we've seen childcare places close, we've seen them struggle, and a lot of parents, at least a lot of our members, we're seeing them rely even more so on that informal piece. So that's a way and a direction that we would go and that we are heading in.
And I think we'll be circulating some resources afterwards, looking at you, Patrice, right? That have lots of recommendations for policy change in the childcare realm, and then also when it comes to virtual learning and what can be done there to make sure that it is equitably accessed. So we'll definitely share those.
Sorry, I was just reading comments in the chat, making sure that we didn't have any further questions, but thank you, Tiffany Chapman, for that comment. It's very true. So if actually we are almost at time, so I think we're done with the questions for this portion. But as Andrea mentioned, I will be sending out some resources that will actually include the transcript of the entire webinar. It'll contain our Michigan fact sheet from this poll, as well as other relevant links and resources from our presenters. So I'd like to just thank everyone again. Thank you to all of our attendees, and thank you to our amazing, amazing panelists. And thank you to our pollsters for helping us do this work. So with that, everybody, goodbye. Thank you for attending.
Thanks.
Thank you, everybody.
Thank you. It was great being here.
5.